Hello, hello, everyone, and happy Thursday Night Live. Thank you so much for being here. Today we have Mary Poole with us. We are really excited for today's talk. So I'm first going to introduce the speaker, then the topic, and you're welcome to share your screen after that. So introducing Mary Poole, an internationally experienced speech-language pathologist with over 20 years of practice across the United States, Europe, and Asia. She holds a Master's of Arts in Speech-Language Pathology from the University of North Carolina at Greensboro and a Bachelor's of Science in Communication Disorders from Bowling Green State University. Her clinical interests include orofacial myofunctional disorders, multidisciplinary care, and community education, with a focus on early identification and parent involvement. Passionate about helping children build strong foundational skills for learning, Mary is a lifelong learner who continues to expand her expertise through ongoing education. Outside of work, she enjoys yoga, cycling, and nurturing her love for plants. You need to give me some tips. Welcome to the Area Circle stage. The topic today is pivot points.
Thank you so much for the introduction. I'm going to get my screen ready to share here.
And I see what you have behind you. I have the same one right here. I actually brought one into my office on purpose. As soon as I moved into my new house, the whole time I was like, it's called snake plant, right? I need a snake plant so bad. So it's right next to me.
All right, I've got it coming.
Yay.
So this is my presentation for today. I will do my best to be brief, but also be expansive at the same time. So
I love it.
what I want to start with is a little bit of where I started my journey. As Renata said, I started my schooling in Ohio. That's where I'm from. And I went to school in Bowling Green. And when I was looking at options for graduate school, I looked at places where I knew people and where I could live a nice life and where I could escape winter. So I ended up actually moving to North Carolina. I ended up moving in with a friend that I knew from my undergraduate college in Ohio. She was working as a teacher, and just out across the hall from that apartment was a couple of international teachers who had come to the United States as part of a program from England to be teachers in local public schools. Um, and as I was doing graduate school, they became some of our friends, and we had a nice conversation about how, well, you guys came here. Can I go to England? Like, how does that work? And how can I do something similar, even though we didn't have the same field? So the closer and closer I got to graduation, the more that I was thinking about it, and I ended up doing my clinical fellowship year still in North Carolina, and eventually was able to find a job where I moved to London and I worked for the NHS. Part of my job was working in a Sure Start clinic, which was a bit like Head Start, but also very different. It was less sort of in a preschool, and it was more providing a clinical support for kids who maybe weren't making the same progress or families that needed support. So that was part of my job. And then the other part of my job was going into British public schools and providing some early intervention groups for at-risk kids who were having challenges with communication at school. So that started this journey of finding other employment overseas. Um, from England, I ended up moving to Belgium. From there, I moved to Vietnam, to Japan, to China, and now to Bangladesh. And all of those jobs have had different pieces that I've learned, not just clinically, but culturally, personally. I've had lots of opportunity to learn different things at different times. And I think a lot of that has been because of either the students that have been in my life the parents that have been in my life, and the other educators and other administrators, other professionals that have been kind of around in my life. And I think that as I look back at my career, there was always one or two kids at each of those places, including my jobs in the US, where there were always some kids that I wasn't successful at treating. For whatever reason, the sort of toolbox that I had at my disposal, everything I tried didn't really help the kid meet their goals. It didn't cause harm, but it certainly didn't have great success. And when I was working in China, I ended up having a student on my caseload who really made me rethink and made me have to pivot and learn something new that I hadn't done in a while, right? I hadn't had this major impetus. I'd had little pieces that had me thinking about different parts of my practice. But this one child in China really helped change things for me. And unfortunately, I'm not in contact with her family. I don't have any way to check in and see how things are going at this point. But I want to tell you a little bit about Elaine. So Elaine really was the person who got me changing the way that I look at how kids learn, at what we need to do for kids in school, and how speech therapists can help. So Elaine was a student who I was given as part of my caseload, as part of a small group. And in that small group, there was one student who was a Gestalt language processor, who at the time I didn't know what to term that, right? So I've learned more about that, and I feel more confident in helping that type of student. In that same group was another student who had experienced a near drowning and was having the effects of a traumatic brain injury and was still dealing with that in grade 4 and probably continues to struggle with some of those challenges. But Elaine was also in that group. And what I was told when I got to the school, when I got her on my caseload, was she's really low. She doesn't have good language skills. She doesn't really seem to understand even things that don't take a lot of language that we could show or we could use manipulatives to do. She doesn't talk a lot. And for the most part, she doesn't really engage or interact. So she's in this group with kids that we think are at a similar level. They all just need basic language development and support. And when you're new to a job and you are still learning the kids on your caseload, you take other people's and other professionals' opinions and you roll that in, but you also spend a lot of time getting to know the kid. And that's what I ended up doing. As I got to know all three of the kids in this group, I got to know Elaine, and the more that there were things that made me go, wait, you understood that, and I didn't explain it, or I didn't explain it well. Or I've pulled a game off of my shelf that we haven't played before, but you've already picked up on, oh, do we pass out 7 cards? Or, oh, it goes this direction when we play the game, right? And the other two in the group, we went over those kinds of things every time we went to play the game, even if it was the same game that we played the time before and we were playing it again, we went over the rules because things didn't stick as easily for them. And that's kind of when I started to think something is different for Elaine that isn't letting her show what she understands and what she knows and what she can communicate. She was not a native English speaker. She was not a Chinese speaker either. I'm going to kind of keep that detail a little bit secret to not let you know exactly what language she spoke. But when she came to the school, no one ever placed her in any support where she could learn English. She was just thrown in a classroom with no additional support for learning English. But what they did instead was they gave her learning support to work on her literacy skills and her numeracy skills without realizing that she'd never gone to school in English. And that made it difficult for her to actually understand and know what was going on. The other thing that I got to know about Elaine was it wasn't that she didn't want to communicate. It's that it was actually difficult for her to communicate. She had a really hard time manipulating her cheeks and her lips and her tongue and her jaw. And at the time, I just saw it as an articulation challenge because I didn't have a different, better way of looking at what she had going on as a way to help her. So this was during COVID times, and I was in Beijing. And for about 4 years, those of us in China experienced COVID. Other places in the world, COVID didn't go for 4 years, but in China it did. So we got very good at um, therapy online. We got really good at finding resources online. We got really good at learning and doing professional development online. And that was kind of my first course that I could try was to find out somebody else's knowledge that would help me help Elaine from far away. Because it wasn't something that I could just go down the street and find someone to help me and mentor me or teach me something new. So I went looking on the internet. I found a lovely course, and it was through Talk Tools, and it was all about lisps. And it was with Robin Merkel Walsh, which I'm sure many of you know the name. Um, and she didn't just open that door to myofunctional disorders, she opened that door into airway and how important airway is, and all the structural pieces that have to be there in order for the functional pieces to be there. And I think that you can see from this picture, we went from her not having a great deal of control over her emotions and over her mouth. This is her smiling. And she was smiling for this picture because she was so excited that we had worked on some of her speech needs, but we did it via working on those muscle movements, working on helping her teeth, working on helping her jaw, working on helping her breathe better. So for me, that was a really big pivot in my career because I went from being a very traditional school-based speech therapist to being a very non-traditional speech therapist. And that pivot wasn't immediate. It has taken time. It has taken a lot of reading and a lot of researching and a lot of learning from other specialists and other knowledgeable members of our community. But I think that Elaine is that really big pivotal moment for me and my career. So we worked together in China, and there came a point where I needed to move on, right? So yet another pivot. Elaine had moved back to her home country with more skills and more ability, and I was going to be leaving China with more skills and ability and knowledge. And I think that for both of us, we came out better than when we got to China. So, um, life changes, and sometimes they throw pivots your way that aren't expected. COVID was one of those, but I think a lot of us have gotten more adept at teletherapy, virtual support, communicating in a means that maybe we weren't ever taught to do. The picture that I've put here is of my mom and dad. So within a day, both of their health needs changed. So on a Friday in July, my mom was diagnosed with breast cancer. And the following day, my dad had hemorrhagic strokes that affected his brainstem and his occipital lobe. So being in China was not something that was sustainable because during COVID, we couldn't leave. We couldn't go anywhere. We couldn't travel outside the country. And if we did, we weren't sure that we would make it back in. So I decided to change where I was working and change how I was working so that I could have the option and availability to be able to go home if and when I needed to support both my parents and my siblings. So that was kind of a big part that helped evolve my practice. It's given me lots of time to consider where I want my life to go, both for my personal health, but also for my professional practice. And I think that some of those changes for me have been very deliberate. Um, there were things that when I looked at how I was looking at patients and looking at clients and looking at the families I was supporting, I feel like I was taught really well to look at symptoms, treat them, make sure that the standard score moved in a positive way. Um, a lot of the kids that I would have referrals for were very your traditional, articulation, language needs. The way that I was taught to look at articulation was very typically developmental. So if you came in with an S and you weren't five, well, we might let that roll until you were five. Um, Same with language goals, using standardized tests to help move on. Um, and even though I worked closely with learning support teachers within the school and teachers within the schools I worked in, I did feel like a lot of the work that I was doing was very siloed. I didn't work with a lot of other professionals. Um, if my school at the time, depending on which school I was in, had a psychologist, sometimes we would talk about scores or talk about a profile and talk about what we could do to help a kid. But for the most part, it was me helping the kid in the best way that I could. Whereas after that point where I worked with Elaine, a lot of how I worked really did change. So one of the things that really changed was instead of just looking at the kid going, oh, they've got this issue, but why? And trying to figure out the why behind the challenge that they were presenting with. I've learned a lot more about tongue tie. I've learned a lot more about orthodontics. I've learned a lot more about breathing and your diaphragm and all of these pieces, typically because the kid in front of me has presented with something that I'm trying to figure out the why. I have a current kid right now who, when I first met this child, the first thing that stood out to me wasn't the disfluent speech. It was the fact that her shoulders were rolled way in front of where her body was. And then the disfluency made more sense because I think her disfluent speech is hooked into her breathing and the fact that she can't move her body in the way that she needs in order to have fluent speech, right? So looking at how our body systems flow together to figure out how we can get her some support. And in looking into the postural piece, we were able to identify more with the tongue tie that she has, which has also impacted her dentition. She's probably in the next week or so going to have one of her teeth removed because it's one of those back ones that she can't get clean with her tongue to where it has some decay that's past the point of us being able to kind of save that tooth. So I think in terms of identifying and treating those root causes. We're working on getting that tongue tie released, but we have some other postural stuff that we need to figure out first. We need her to feel better so that she doesn't keep complaining that she can't eat on that side of her mouth and is only focusing on the other. And that's where I think being more aware and centering those airway needs has not just made me a better speech therapist, but it's made me a better holistic practitioner. It's let me look and see how things are connected so that when we get to the disfluency part, which is very much the traditional view of what I would have seen myself 5 or 6 years ago looking, well, I just have to treat the disfluency. We actually can put all of these other pieces in place that mean that when we're ready to kind of work up that hierarchy to get to that place where we're putting the breathing and we're putting the speech part together into fluent speech, what we see is that it might not take as much time. And she's got those underlying skills that make it easier for her to have fluent speech as we get there. And I think that working with other connected professionals is a really important piece. And it's actually what I spend a lot of my time trying to find out is going, does anybody know somebody who is knowledgeable about airway, is knowledgeable about tongue tie, is knowledgeable about fascia, is knowledgeable about fill in the blank in my region. Because where I am right now in Bangladesh, I don't have the luxury of walking down the street to my local doctor's office and absolutely knowing that the doctor inside that specialty office will have that airway awareness and that airway knowledge that I need for my clients. So I've been using resources in the region. I have professionals that I know in Japan, South Korea, China, Thailand, Malaysia, Singapore, India. Um, and I'm pretty sure I've got one figured out for Mongolia. We're still working on that one officially, but we're working on it. Because I also try to find, professionals that can support families in their native language, right? In a language that they're most comfortable with, so that when they can have some education about what's going on for the child, it happens in a language that they feel the most comfortable asking questions. It's in a language that they understand and can then go back and explain to their mom and dad, grandma and grandpa, or aunts and uncles, because families do make decisions a lot of times together. So trying to find things that are connected across regions is sometimes helpful for a lot of our families. And it also helps because we don't necessarily have that right at our doorstep. So, where I usually start with parents, with teachers, with just about anyone, um, is working in a very easy way about explaining why the airway is important. And I think most people generally have that understanding of, well, if you can't breathe, you might die, right? Most people understand that. But I think sometimes when you bring in how it connects to other parts of life, I think it helps them understand, especially for kids, we know that growth requires that deep sleep. It's how our body repairs and grows, and that's a piece of it. Working in a school, we look at how, sleep helps us consolidate our learning and our memory for that day. And it gets rid of things that it maybe doesn't think are as important. I don't know about you guys, but I find that my brain gets rid of more than I'd like it to when I go to sleep every night. Maybe that's an age thing, maybe not. We shall see. Um, but talking through how our body gets rid of waste from our cells, and that includes our brain, right? How it helps with setting off the hormones and the neurotransmitters and the chemicals that help us digest our food. One of the typical examples for this that I give parents is our airport is actually, I'm kind of under the flight path. Um, and most of the flights that we have are kind of on the edges of everybody's flight path map, right? So for the Southeast Asia region, we're on the very, very edge. For the South Asia, we're on the very, very edge. For the Middle East, we're way out on the edge, which means most of our flights go between 10 o'clock at night and 5 o'clock in the morning. So one of the things I talk to parents about is when you have to wake up at a really odd time to go catch that flight. And I say, you don't feel sick, but maybe your tummy doesn't feel great, right? You just don't feel like you're quite ready to eat. And I explain to them that that's part of your brain's job is because you've woken it up in the middle of it helping process your food and move things along in your intestines and in your stomach because those hormones are set off as part of sleep, right? They're helping you. And I think that parents, when you can take something really abstract like neurotransmitters and bring it to something concrete that they can link to something that they felt in their own bodies, it helps them understand some of the things that their child might be feeling as well. We know that we all need to be awake and asleep. We all need to have things that help us get our work done. And we also want to feel good when we're doing it. So trying to break down some of those fancy chemical names for hormones and bring them into the things that we need to do, I think really helps people understand. We also talk through how a lot of times kids need to be well, right? I live in a place right now and have lived for quite a few years in places where pollution is a really big problem. And on top of pollution, you then get allergies or you get chronic illness, which then Is it the chicken or the egg, right, for where the airway issue has started or where it is at this moment? So that's kind of where I start with a lot of parents, is talking about why airway is important and why I'm looking at all of these areas, not just, well, they can't say their L's. Why are you looking at how are they eating, right? They just can't say their L's, right? I try and put some more foundation there for the family, and the teachers as well, right? So from there, I kind of move into why airway is so important. I have a little guy right now on my caseload who, in the last school year, everyone knew who he was. Even if they didn't know his name, everybody that had ever walked in that classroom, their eyes immediately, they knew who this kid was. Because he took everyone's time and he took everyone's attention because he was completely dysregulated. And his dysregulation was in everything. Even things that he liked and enjoyed, he couldn't get himself to do or complete or not mess up, right? Everything was a challenge for him. And it did affect his school attendance. There was a period of time that we said, look, he can only be here until lunchtime, and then he needs to head home in the afternoon because he's too dysregulated to be here at school. And he had been referred to me for some speech issues and some feeding issues, which were present. But I also advocated to his family that I really, really, really wanted him to be seen by an ENT. He had really, I mean, absolutely dark circles under his eyes, and he just had that look of just desperation to try to get through his day. But as Sharon Moore in her book, the Sleep-Wrecked Kids, um, he was also that wired, tired kid where even when he was overtired, his motor just kept going. To where when I looked at all of the things that were affected for him, his attention was affected, right? He couldn't pay attention to learn because his body was dysregulated. He certainly wasn't going to remember the things that were being taught to him because he wasn't paying attention to them. He might get something started or he might not because he was dysregulated. He might or might not be able to maintain attention and focus to what he was doing, even if it was something fun that he wanted to do, like building a tower and making a house or building a racetrack with the car that he really liked. His body gave out, right? He was exhausted by lunchtime, and you could see it in his face of, I just need to lay down, but I can't lay down. And it also affected his motivation, right? Even to do things at school. And at one point, he was coming part days, but then when he would get even more ill, he also was missing school and missing school with more regularity. Throughout all of that, he was rarely at school on time, right? So every morning he was missing that sort of peer and teacher connection in the morning that happened with morning meeting or those different pieces. And I was desperate to get parents to go. One of the parents was going, wait, everything you're saying relates to how I feel now as a grown-up. The other parent had a look of disdain on her face as we were going through our conversation, going, I don't think that's a thing. I've never heard of this, right? That can't be it. He just needs more help. So I looked and found professionals in Australia. I found professionals in Singapore that they could go see. And when they went, they didn't tell me that they were going, right? I try to introduce people the best I can. I try to send along data or information as much as I can and as much as parents would like me to do. But they didn't tell me they were going. But they went. And when they came back, they met with me. And it was actually the parent who was the most skeptical who came in and said, thank you for making us go. We found out that his adenoids are blocking over 75% of his nasal airway, and his tonsils are equally as big. And and we're going to have the surgery in the summer to help him, which was great. Now, they had the surgery in the summer, and when they came back to me again and said, oh my goodness, when the doctor got in there, we didn't even know, but the surgery took so much longer than what they told us, and we were really worried that something bad had happened. But what actually happened is when the doctor came out, he said the surgery ended up taking longer because his tonsils were even bigger than we thought based on scans and images. So it took us a lot longer to actually address the issue. So that was toward the end of July. The kid came in first week of school in August, and I walked in the classroom and I couldn't find the kid. I looked around, I'm going, what? I know he's supposed to be in this class. Maybe I'm in the wrong class. But it turned out that he was just regulated. He didn't stand out. He was just over doing everything that all the other kids in the class were doing. And that wasn't my experience. My experience of this kid was the same as everyone else's last year, where he was dysregulated. He was very easy to spot in the crowd. To where I think seeing those differences has not only helped that family and that child, right? They've got better relationships, they've got better ways of getting through their days. He's got a better airway, and now we can really address more of the feeding skill. We can address resting posture, which will lead into the articulation piece. There's all of these little pieces that are stacking up quite nicely for this kid. But I also now have parents in the community who, when other people bring up something, they're now advocates for airway centric support and speech language pathology and myofunctional therapy and all of the things that I've been working to kind of help parents and families understand. So, these are some of the little pivots that I've done in my practice that have helped me embed more of these items and more of these things in the way that I practice. So, one of the first things that I have done is I've started to do the Ferrest 6 as a pediatric sleep disordered breathing screening as part of every evaluation that I do. And because I'm doing that screening as part of what I do, I also have a physical exam and photos of the craniofacial respiratory complex in my report, even if the concern that's brought to me is about language or is about fluency or is about voice. All of it, I do the Ferrest 6. And it sort of, for me, I do it up through high school age kids, because what I find working outside the US is that there isn't necessarily early intervention. There isn't necessarily intervention. There's a lot more wait and see. So oftentimes, just because the age of a child is somebody that should have it figured out, doesn't mean that it is. So sometimes we're identifying challenges that have just been, well, that's just how he is. That's just that's just what she does, right? She always has a runny nose. Oh, he always gets sick every winter, right? So identifying and finding some solutions for that. For my little ones that eat snack at school, kind of as a routine, usually my elementary kids, I try to make sure that I observe a snack time or a lunch time to see, is their feeding skill better, worse, the same as what I would kind of expect, especially if it's a kid who's coming up for articulation concerns or fluency concerns. Um, the other thing that has changed for me is I often talk to parents a lot more about their history, both of birth and their kind of early life. When I worked in the US, it was not something that we routinely did. We sort of did the IEP process and boom, 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 we did the test. They needed 2 scores of 78 or below. They qualified or they didn't. And we moved forward with putting goals together. We met with parents, boom, boom. But working internationally, I have a lot more access to parents, and I have a lot more access to parents who can take time off and come into school and, kind of prioritize that connection with the people in the school. So it's been a lot easier to get some of those early history pieces figured out, to kind of work backwards and go, yeah, okay, it's not going to change what we do now, but it is helpful to know. One of my students was a micropreemie. He was born at 27 weeks. He spent time in the NICU. He was only ever bottle fed, right? So as a 14-year-old, when he has a 29 millimeter palate, it makes sense that he's having that challenge with his craniofacial growth because I know more about his history. So that is one of those pieces that I've added in that I didn't typically do before. It's the school, we do what we need, we move forward. Whereas now I'm trying to involve parents and get more of that history piece as well. Um, One of the pieces I'm going to skip just for a moment, and I'm going to skip to hierarchy because, like I said before, putting some of these foundational pieces, like being able to breathe well, being able to get good sleep, if we can get some of those pieces ironed out as the foundation, it makes it easier for us to address those first set of goals. Oftentimes, those goals are about pre-release and working up to a tongue tie release, but we're setting that foundation for orofacial myofunctional skills, which then lead on to whatever the goal is that was a more traditional speech and language goal, whether it's articulation, fluency, etc. We kind of keep that, and kind of approaching things through that hierarchy has been really helpful. For education, there's a lot that I do, right? I will say that those of you that are working in the US, and I'll even put some other places, Brazil, um, I'm going to say Germany. You've got great professionals around, and a lot of people are like-minded and thinking about something similar to where it's easier to find professionals that you can use. There's a lot of parents and teachers that are more used to dealing with early intervention services, birth to 3. There's more people who just have an idea that, like, but this is how we, for better or worse, there is a kind of a step by step for how we introduce foods and solids and what do we try at this age and how do we work through that, that I find isn't necessarily prevalent everywhere. So a lot of what I do is a little bit of drip, drip, drip. So I've put here educating educators, but I consider doctors to be educators. I consider ENTs to be educators, right? They might be educating on a very narrow window of things, but they still are educating parents on what's going on with their child. And often what I do is drip a little comment, right? If it's a school meeting and there's a bunch of teachers and I go, "Oh, well, hmm, well, how do they eat?" Right? Are they always the last one? Right? And I can put in those little drippy comments, but it gets teachers thinking about similar ideas when they go and look at that kid again, right? Oh, I noticed that he always has those dark circles. Do his mom and dad? Right? Maybe I haven't met mom and dad, but I can look at the kid or I look at a picture of the kid and wonder about that. Sometimes teachers will bring as evidence. They'll bring photos or videos, we can look at that. But I use those as opportunities to provide a little bit of an education. And again, it could be one little comment, but over time, those drip, drip, drips become a mass, right? And it starts to change things. I do the same thing through training. The more that I explain things and teach people, the better eyes they have and the better referrals they give. The more I include parents, the more I go to doctor's appointments, whether it's orthodontist or ENT or anything else. If parents can involve me, I can help educate doctors. I can help educate parents on what the doctor has said to them, on what the next steps need to be. And I find that we get better carryover, both of goals and the medical pieces that need to be put in place. So the outcome for me is I actually get more referrals now. I get more kids that are being brought up with challenges, and I'm getting them earlier in their school career because I've really worked hard with my preschool and my kindergarten teachers to get everything going as much as I can, the earliest as possible, because it helps those kids avoid some of those challenges down the line. And for me, it really has been a case of the more I've learned, the more I've seen. And for me, that more is just so much better, right? My kids are making better progress in therapy. My families are happier. My teachers are going, "Oh, And can you help him too? And their classroom is going better because kids are more regulated and ready to learn. There are definitely challenges. Um, Accessing specialists, definitely one of them. Sometimes it's not as easy for parents and families to travel. So if families are not willing or not able to do procedures or see specialists here in Bangladesh, then we often have to arrange what they need around school holidays, right? So they might have to travel, which takes money, um, and the time off work and all of these pieces, which means some of my kids, even though parents are on board, they're ready, willing, able. It still means that we might wait 10 months to get them to a place where they can actually go and do the tongue tie release, or where they can go and get their tonsils out, or they can go and do the thing that they feel comfortable doing in a place that they feel comfortable doing it in, which means we often have to kind of be a little bit adaptive with how we implement therapy, right? There have been some kids that I just look at parents and say, then it's not the right time for us to start therapy. Yes, your child has needs. Of course, I want to support them. Here's some things that we can do either in the classroom or at home, but I don't think therapy is the right thing for your child right now. There have been other kids that we've started, taken a little break, come back to it, taken another break, come back to it, taken a little break. So it just being creative, to get through some of those challenges. I'm sure everybody else works with intercultural and multicultural populations. Sometimes traditional views of, what foods to use or how we feed or how long we wait and see. Some of those pieces still play into what I do at an international school in a different community than the US. And the last thing I'm going to put here is information in the air. So sometimes the challenges are people have too much information in the air, and sometimes they don't have enough. So one of the things that I've seen change over the past couple years is how many more people, when you go, well, do you know what sleep apnea is? Now most people go, oh yeah, yeah, I know what that is, right? Whereas for other things, it's not in the air that people have learned about these things through pop media, through, the little ad that pops up on their phone, to where I think the more that we talk about things, the more it does become part of the air, right? And the air we breathe is very important. So getting better ideas and better facts into the air, I think, is a really good thing. Um, and for me, I see beauty in that pivot, in that need to change, in the challenges that we face, because sometimes through those challenges, we come up with a better example or a better way to talk about something, or we have to find a new professional to refer to, or we get a breakthrough with a family member, or any of these things can happen. And I think that that's where the beauty is in what we have the privilege to do every day through all of our practices, whether it's speech or OT or RDH or any number of our professions. I think we have so much to give and so many different ways that we can affect change that benefits the kids that we work with and the grown-ups that come with them. So, my question for you that I'm going to leave you with is, where can you pivot in your practice? What can you add in? What drop or drip can you make that will help you change somebody else's life the way that Elaine changed mine?
Ta-da! Wow, that was amazing. Anne is already saying from one SLP to another. This was a powerful presentation that speaks to what can be accomplished as a school-based speech-language pathologist who is a self-advocate, dedicated and committed to addressing the why behind the symptoms through the lens of airway. How fortunate you are to have access to parents as an international SLP. You go, girl. I'm going to add that one.
Yeah, thank you so much.
Wonderful. Now I'm going to ask you some questions so we can put on social media. And if anybody is over here would like to ask a question, please let us know. Sakshi said, wow, thank you for sharing with us. Let me make sure. I don't know how to turn that off so people don't message me here. Do not disturb. Okay, got it. So how does Mary define pivot points in the context of speech-language pathology?
That's a great question. I think that it's one of those pieces that I was always told that, how do I phrase this? You can make data, you can make data represent any idea that you want without changing the data, right?
Mhm.
So there are a lot of things that I was taught that didn't match up for me in the real world, right? I
Mhm.
was taught NSOME, boo. And yet I've had double hip reconstruction. I've had a frozen shoulder surgery. And in every single instance, people have gone back to muscles and function and structure.
Mhm.
So even as a person, my professional life had to change because my personal life and the data in front of me didn't match the data I'd always been told or been shown. And the more that I look, the more research, the more information, the more amazing stories I see from others are also influencing. And I don't mean influencer, I mean professionally influencing how I seek information, how I judge information, how I make decisions on that information. And I think every day we have that ability to pivot and learn something new, either for ourselves or for the people that we work with or the people that we serve. And I think that we have to do that as a profession. When we find new data that shows us a way forward, we need to be taking it in, not just going, well, I was never told that before. I run
Hmm.
across too many doctors that have that approach, whether they're orthodontists who want to do extractions, whether they are ENTs who are like, "Pff, they're not snotty, they're fine. If I treated every kid like this, I'd be treating thousands of kids a year." That's a direct quote from one of the doctors I met with.
Wow.
And
Wow.
it's hard for me not to respond with, then you're not treating thousands of kids who need help every
Exactly.
year,
Mm-hmm.
right? But I knew that that doctor was not going to be open to me talking about things. So I
Mm-hmm.
had to make a pivot in that moment too, to go, not the time, right? And take myself out of that. It wasn't the right opportunity. It wasn't the right way to keep going forward.
I love that. A dentist mom recently posted a question in a big dental group on Facebook asking about her child's, I think was a class 3, and he was about, I think, 6 or 7. And a prominent orthodontist mentioned exactly that. No, you have time. You can wait. There's nothing we need to do right now. But they're missing all of the functional issues. I mean, for this area to function properly, one, you need to be able to breathe. You need upper and lower jaw to be big enough so the tongue can live up there. But just by looking at their teeth, yes, we can fix that in about 3 years. What's going to happen in those 3 years of dysfunction?
Well, and
So
that's my little one that I talked about who was dysregulated most of last school
mhm,
year. He has an overjet, right? That any dentist and any doctor would go, we'll fix it later.
mhm,
But they didn't see the impact that that was having on top of the adenoids and the
mhm.
tonsils. And he still has difficulty keeping his lips together because of that overjet. And
Wow.
we're working on it. But getting parents to now realize that it wasn't just the tonsils and adenoids that were the issue. Those were just the first issue, right? And building is an ongoing uphill challenge.
It is, and I really think that that's where the issue is with healthcare professionals is that we don't speak to each other. We go to school, we learn what we're supposed to learn, and we just stay in our lane in a way that we don't even want to learn about anybody else. Whenever we say stay in your lane is just practice what you know, however, where you're allowed to. However, it's so important for us to understand the child and the patient as a whole. Because this orthodontist that's saying, we can totally wait, I can fix that later. He is doing that from the goodness of his heart. He doesn't think there's anything wrong. He doesn't see anything wrong. He's not
Nope.
practicing, wrong. He's doing what he was taught to do. So it is so difficult to be able to approach those that just don't see it, and most do not want to see it, to
I,
get them
I,
to at least speak to us.
I run into that quite frequently. I just had a little one go in the summer to their home country, and I'd found a specialist. I'd talked to the specialist, not about the kid, but to find out if the specialist was what I
Mhm.
needed them to be. And the parent, again, didn't say that they were going to go or not go. They kind of left it, we're going to try. And when they got back over the summer, they said, oh, well, we went to 3 doctors. I said, oh, who did you go see? Oh, well, we went to our regular GP,
Which,
we went to his regular dentist, and we went to an ENT. They all said he's absolutely fine.
oh gosh,
This kid has like a 25% grade 4, right?
wow.
Like not like right on the line of not 0%, not 50% where it's a grade 3, but like right on the edge. And they all just went, he's fine. He talks to me. He doesn't have a runny nose. He's fine.
Mm,
So that conversation about where are we going to go with therapy, we had a tough conversation with mom saying, you went to doctors, and I didn't use this phrase with the parent. I said, but you've put yourself in a pickle because you found doctors that benefited how you feel,
mm-hmm.
but it's the opposite of what I feel. And
Yeah,
unfortunately, we have gone down this path and we've tried everything we can do with the structure he has.
yeah.
But the
A lot
tongue
of
tie
them.
is the wall, and we can't get over it. We can't get around it. We can't go under it. We're
Mhm.
stuck. So right now, I went back through all of the evaluation. I went back through recordings that we have of, the kid in
Mhm.
therapy, and said, for right now, we have to say pause on therapy. It's not that I don't want to help your child, but I can't help from a function standpoint until we figure out structure.
Mhm. Good for you. And it's
But
difficult as a
but it's
professional
really
to,
hard.
yes, to be, because so many myofunctional therapists will ask me, okay, I'm treating this child and they don't want to do expansion. They don't want to get a tongue tie release. What do? Do you just keep going doing therapy until they burn out? Because it's gonna get to a point, they're like, why am I doing what I'm doing? You have to
Yeah.
be able to address everything, airway,
And,
upper and lower jaw, and muscle.
and
It's
that's
not just
where
one.
I do feel like I'm very privileged to be this non-traditional SLP working in an international school because how would this work on an IEP,
Oh gosh.
right?
And we all
Once
know
you,
that they need help.
right? We all, and that's the thing. It's not that I don't think that this child needs help. They just need help that I can't give,
Yeah.
right? I can point the parents in the right direction. I can help them find good people. But unless parents want that support and want to see that there is a challenge, there kind of has to be. I lived in North Carolina, and this one was
So
something that I
close.
didn't learn in Ohio, but it was that coming to Jesus moment, right? Where they have to get
100%.
at that place where they are ready to take action,
Mm-hmm.
and it's not just me pulling them to try to make action. They
100%.
have to take a step. So that's kind of where I try, and
Mm-hmm.
I'm very blessed to be doing it in a place where I don't have all of the same constraints that maybe I would in a school in the US.
Yes, and that's why it's so important to build your local community, especially if you're seeing patients locally. We tell everyone here on Airway Circle, we do what we can live online to offer all this education to everybody, to offer all these resources, directory and all of that, Facebook group where you can talk to each other, WhatsApp group, whatever. However, if I have a local patient, like both of my kids, and they need expansion, and I don't have somebody, down the road that can help me, and I cannot afford to travel all over the place to get this treatment done, like it's just almost impossible. I have one patient that I sent for the first time with this provider overseas that I've never worked with. The patient came back telling me that the provider recommended them not doing myofunctional therapy. I'll give you some exercises. You don't have to do it. It doesn't really work. Everybody works differently. However, that provider asked me exactly what was my protocol and how was I working. He wanted the specifics of my exercises and everything, but he is telling the patients not to work with me or any
So,
other myofunctional therapist.
so one of the things that I've gotten, I'm going to say reasonably good at, I'm still not great at it, but reasonably good, is talking to providers and figuring out their mindset.
Mm,
I'm okay if they don't know anything about airway, but if they're willing to go, huh, I hadn't thought about it that way,
I know.
I can work with that,
That's true.
right? So I found an orthodontist here who every time I get a free webinar that's coming into my email, I'm like, forward, go
Every
here,
Thursday.
right? Right? But I'm sending all of those little, again, drip, drip, drip
Yes.
to my orthodontist. Do I take every single patient that I have that needs support to this orthodontist? No.
Mhm.
But there are a few that I go, but your traditional orthodontics are exactly what this kid needs. You know
Mhm.
that that kid needs expanded. Let's make it happen. Right? So even from a traditional perspective, how can I leverage it? Right? And I find that my best way to do that is through that conversation and figuring out mindset. It's not figuring out skill, it's not figuring out how good
Mhm.
they are or bad they are, but do they have a mindset where they're open to learning? And that's how I
Mhm.
found great people in China. It's how I found great people here. It's how I've figured out how to make that team when I don't just have airway professionals at my fingertips or down the road.
Amazing. Amazing. Somebody, Anne said, knowing when you need to step aside because your skill set is not a priority right now is a unique clinical strength that we were talking about earlier. That is absolutely right. We need to understand what our limitations, what the patient's limitations are. By the way, did you guys see my shirt? I just stepped back and I saw it. Isn't it so cute? We
Oh,
have them on the website. There's limited quantity. I think I only have like 30 of them. So run in there and get your shirt. They're V-neck, super cool too. Work out in them, and then you're telling the whole gym that they should have their mouth closed. It says
yeah.
everything we knows. Oh my goodness, Mary, thank you so much for meeting us. I know this was last minute, but it's been so
Yeah,
informative.
I'm happy to come in. I'm sure that there are other ways that people are thinking, I am doing something. It might be small, but
Mhm.
again, what I talk to parents and teachers about is, look, for every marathon, you've got to take your first step, right? So that
Mhm.
little small pivot of going, actually, I am going to start watching kids eat snack. Great. That's one little way that you can move forward and implement things, even in a school where maybe it's not the easiest thing to get started.
I love that. Yesterday, I was volunteering my son's school, and it's impossible, right? I mean, they had a fall festival, and I was in one of the stations, and every kid that was going by, I cannot tell you guys how many noses I cleaned. It was outside, and it was cold, and the teachers didn't even care. And these kids have like snot going down, and I'm like, that's not gonna happen if I'm around. And I would get a tissue and I would help them clean their nose, and then I'll tell the teacher, and the teacher would, I would tell the teacher, reduces their oxygen by 18%. If they can't breathe the out of their nose, they're way more likely to be hyper and all of these things. And they're looking at me like, who is this person right here? And eventually there was a teacher that was really interested in what I was saying. And she is the IPE. They have a new program in this private school just for children with autism. And she started talking to me about it, and we talked about the cortisol levels with autistic children and the importance of them breathing and the importance of them having enough room for their teeth and everything. And she was so interested. And I was like, I'm actually speaking at the school next week before parents. And I was like, I would love to come talk to the teachers and see what else you guys can do, while you are in class, because it's going to benefit everybody.
Yeah.
Somebody needs to be looking.
Yeah. And that's where if it needs to be me that's the nerd in every meeting going, but what about their airway? Then that's the thing that I'm willing to do. Right.
100%. All right. Well, thank you so much, Mary. Have a wonderful day. Everybody, please share these lives with a colleague. If you can only invite one to come join us, we're gonna have double people next week. We work so hard to be able to bring all this education for you guys, but we need your help. I can't do this on my own. I need you guys to help me share and invite more people, because if you meet that professional that you mentioned something and they go, I haven't thought about that. Here's a link. It's
Yeah.
free. Just come join us. And if you guys are overseas, the Area Circle Lives, they do stay on throughout the night. So we only remove them the next day. So whenever you guys are waking up over there in Europe and in those other countries, you still can catch it before it comes off the air. But thank you, everybody. Have a wonderful day. We love you. Mwah. Thank you, Mary.
You're welcome. Bye-bye.